Good evening, friends. On behalf of Joshi's Kerala Group, BASAVARAJ sir is agreed to give the very special class about the color therapy. It is planning to give this session twice a week, that is all Wednesdays and Thursdays, but will be according to his free time. So we have to attend the session till the end. He will declare when will be the next class. And all of us know that there is a very special class is coming from 25th July to 1st August. That is from Madam Bhupinder Kaur. During that time, because that course is all the 8 days from 7 to 10 p.m. and it is continuously. So there will be no free sessions or no paid session during that time because that is based on the tri-origin energy level. And we all know that BASAVARAJ are already formed an equipment for diagnosing a patient. Now he is doing another advanced version of such a device. It is named as Oohy. He is in the process of giving this device to you all. So he is very busy with that work also. So we know that he had given such a session during 2022. After that, he got free time only this time, this month. So he is ready to give the session for us. Actually, today we will give the session as open to all participants, but from next class onwards, it will be in the closed group only. That is, on the paid participants only can attend this course. Today, this is open to all. We all know that this is very important among the healers because it will give the result spontaneously. Spontaneous result will be getting out of this color therapy. It is especially from BASAVARAJ sir. And we all together, with a very warm greeting, we can invite Dr. BASAVARAJ sir to this platform. Good evening, sir. Welcome, sir.
Good evening.
Actually, you are already given such a class before, but we are awaiting. We all know that every time you're giving a very special thing, very new thing in each session. So we all are waiting, sir. Thank you, sir. Welcome, sir. Thank you.
So I welcome you all for color numerology, color therapy. All are welcome. Color therapy. So as name indicates, here color is the tool to make energy changes in the body. Why we are choosing colors? How effective they are healing into the body? So let's see. There are many vibrational methods in our treatment and some other treatment we are giving based on medicines also. There are two kinds of healing methodologies in the world since ancient times. So one is the vibrational medicine, which changes the body constitution, which changes the energy of the organ. Another type of medicine we are giving is some herbal or some chemical medicine orally to the body. So that also changes your body constitution by food or that herbal which we use or chemicals. But vibrational medicines are quite effective and long lasting and immediate relief you can see. So there are so many different methodologies to change your body energy levels. We all know the acupressure, acupuncture, and batch flower, magnetic therapy and all. Out of that, color therapy is the one. Because of its high frequency energy, it is able to change your body meridians, chakras, and it is able to change the body constitution of the body. Body constitution, very easiest way. So as you seen in the PPT, the frequency of the color is 10 to the power of 14 hertz, which is much higher frequency than your mobile which you are using right now. So with this high frequency, definitely we can make some magical changes in the patient. Sometimes it gives a quick relief if it is a small changes, or else it may takes a little time to change your body constitution depending upon patient illness and patient energy levels. But overall, you can use for even acute diseases as well as for chronic diseases. For chronic diseases, we are using few weeks to the few months. For acute diseases, sometimes you will get a results within few hours. So those magical changes I will show you today with a colored dot. So how can you change the, the illness into the disease-free life? A small dot on the meridians, chakras, or reflex points is enough to change the body energy. Why this small energy it works on the body? Because the human frequency, the human body is having very small energy variations. It around 9 to 12 millivolts, which you can see in the ECG waveform. A small voltage and current variations in the body. To change that, to change the pattern of the energy, you also require a very small energy. So that you can use a small magnet or seed or color or needle, very small energy or pressure. See this, it's very clear any illness in the body which happens due to imbalance flow of chi. Chi is not flowing into the organ or specific tissues properly. For example, if you want to give, most of us we are suffering with lower back pain. Why? In a day, almost we receive more than 20 to 25 patients in my clinic. They are walking into my clinic with MRI reports. We consult daily 150 patients, out of which 25 to 30 patients are related to back pain. Why that use number of people are rushing into the clinic? Because the way we interpret, the way we understand the disease is completely different than the modern science. If anybody go to any good multi-specialty hospitals saying that back pain, what is the reply you get? First, they give painkiller, then muscle relaxation, then they will suggest you some physiotherapy, then they may suggest some massages, or you may go to any Ayurvedic centers who does panchakarma. What else you do? Many more things. After doing all these things, what is the feedback of the patient? What you can expect? They're telling I have back pain since 5 years, 6 years, 10 years, 15 years. It's a very common thing which we see. Few people further, they extend their pain to the leg. Then doctor called this is a sciatica nerve. which is pinching in the lumbar, and due to that, the sciatica pain is getting. Through this color therapy, you can cure all those patients within few weeks. Max to the max 3 to 5 weeks. What you are going to do there? Before applying colors, we are understanding what is lumbar spondylosis, why it is happening, what is the root cause, what happening exactly in the lumbar. If you go to doctor, now my suggestion is, if you are any of you are suggesting suffering with back pain, lumbar spondylosis, sciatica, cervical spondylosis, my 15 years of experience is, don't go any orthopedic doctor. They are misleading you. Why? Because they don't know. They learned the shape of the disc, the diameter of the disc, anatomy of the spinal cord and nerves. They learned how to cut, apply screws, and again rejoin. If you go to that person, you never heal. Even after surgery also, many patients, they are very clearly telling, I got surgery, but I am not cured. Still I have persisting with the back pain. Am I right? Same thing. Then what you can do? You are going to very number one multi-specialty hospital. In that you are going to number one orthopedic doctor, surgeon. With that, finally you are going to end with painkillers and simple physiotherapy or surgery. And before that, you are spending thousands of rupees for the scanning itself. Because many of you are either in 30s or 50s or 70s. You feel back pain. That's quite common. But in the color therapy, the way we look into disease is completely different. The first important thing, who is governing lumbar? So lumbar is governed by kidney and liver, two organs, kidney and liver. Because those two organs are governing your what? Lower warmer. Your body is divided into three warmers. Above diaphragm is upper warmer, below diaphragm and above your solar flex, umbilical area, is your middle warmer, which is responsible for digestion, and chest, which is responsible for breathing and as well as circulation. The below umbilicus till genetic area, this is your lower warmer. In that lower warmer, kidney and liver are major two organs which is governing your lumbar. Not only lumbar, around the umbilical area below that, uterus, prostate, genetical organs, ovaries, even cervix, all these issues, any issues, is governed by liver and kidney. If you are not understanding a triple warmer mechanism, it's difficult to understand the healing system here. You are able to see this triple warmer?
Yes, sir.
So lower warmer, we call it as a fire. Middle warmer, we call it as a vessel, which is storing your food and digesting your food. And upper warmer, this is your mist or smoke. So which is covering the gaseous the gaseous form of your food and water. By seeing this picture, you can easily understand and comment on this, why you are getting back pain. It's very clear the most of gynec issues, lower back issues, sciatica, hip joint pain, and knee pain. It's because you don't have enough fire. You don't have enough kidney essence or kidney yang energy or Ming Men energy. That is a major drawback why the people are getting into gynec issues and as well as lower back issues. It's a lack of fire. We normally tell just look like a gas burner, cooker, and whistle. Many ladies can understand this better. Every day you are using cookers to cook. The whistle, the steam which you are getting, that is governing your upper warmer. The cooker itself, it represents your middle warmer. The gas burner, which represents your lower warmer. So now, if anybody of you are getting lower back pain, it's because of lack of fire. I'm not telling all 10 patients will get into the same one. Out of 10, 7 people are getting into a lumbar spondylosis or lower back problem because of kidney yang deficiency or a liver yang deficiency. Either liver cold or kidney cold. What happens if liver become cold or kidney become cold? Anybody? There is a two energies which is governing you. The first energy is yang, which is responsible for functioning and circulation. The second one is yin, which is responsible for holding and nourishment. Now, in your lumbar area, yin is more, yang is less. Yin is more, yang is less. This is the case almost 8 patients out of 10. Only 2 patients, they are having yang is more, yin is less. Due to excess of kidney heat also, they get back pain. But that percentage of the patient is very less than 20%. But out of 10, 8 patients are belongs to the kidney and liver cold. Why you are getting kidney and liver cold? Very simple reason. The first reason, your liver becoming cold because of your refined oil. Or you're eating outside, that person is cooking in the same oil 100 times. That oil is not good. When you are feeding the wrong oil to the body, the organ which is going to suffer is liver. Liver only. Be clear, the what oil you are giving, it should not be refined It should not be processed. It should not be added with any chemicals. Make sure that these three qualities. After that, where to get oil? Very simple. Take little seeds. There are small machines available in the market. By paying 15,000-20,000, you can make it ready. Actually, oil should not be stored more than 1 month. If you want to get maximum energy from the oil, the moment you mill that oil, grind that oil, within 1 month you should use. The moment if you add preservatives and if you use late, the energy of the food declines. For example, if you take fruit, fresh food, today 100% energy, tomorrow 80, 60, 50, 40. If you see after 4 days, almost that fruit becoming shrinking and it becoming rotten and the smell coming out of that. Means day by day, if it is a fruits and vegetable, within 3-4 days, the energy is declining. Similarly, oil also. It's not like that expiry date is 1 year, you can use till 1 year. That energy is declining day by day. My experience is if you want to benefit out of oil and take care of your liver and you don't want to go to any doctor for the liver problem, use fresh oil within 2 to 3 weeks, that too without refined. If seeds are native breed, superb. Your liver is smiling always. And the second important thing people are getting back pain is a lack of physical activity. When you're not bending your lumbar like this every day, it becomes cold. And many people, they're sitting in front of laptop more than 8 to 10 hours. 8 to 10 hours. Your body is designed for work and you're sitting. So obviously, when you sit more and more, your lumbar hang goes down and down. There's a third reason why you are getting back pain. And fourth one is just see this picture. I'm showing the lower warmer as a fire. The lower warmer as a fire. From where you are getting fire? My question. From where you are getting that fire? Are we using candles and you are using the lamp which you are pouring oil into that and normally in Diwali time. From where that fire comes? From the oil. Similarly, in your body, the finest energy of your body is SVF, sexual vital fluid. That is the finest energy of your body. So that will be there in the form of oil. In Chinese, it is called as a Jing energy or kidney essence. In Ayurveda, it is called Shukradhatu. Normally, who will get back pain? Who spends more? They are having this much of oil and they are spending more and more and more. How you spend oil? That kidney essence. 1. Intercourse. 2nd, sleeping in the late night. 3rd, doing more travel. 4th, working without work gap. Excess of stress. For example, if you have 100 ml of oil, the kidney essence, do you know how much you spend? 110 ml. Arey Baba, you are having only 100 ml of kidney essence and you are spending 110 energy, 110 ml. Do you know who is consuming more of your kidney essence? It's brain only. Have you eaten beja fry? Who is your brain? It's a 99% oil only. It's a fat only. And that fat is made with kidney essence. If you give more and more work to the mind, obviously your kidney essence go down, down, down. It becomes zero. Some days it becomes negative. You're having 100 ml and spending 110 ml. Do you know another 10 ml from where you are getting? You're squeezing your bone. From that you are extracting that essence. The bones become weaker and weaker and weaker and brittle and brittle. And you are getting, ooh, very painful. Do you think your move will work here? Pain oil will work here. These are all temporary. So that's what, when the kidney essence goes down in the body, obviously the fire become diminished. For example, if you keep your burner in maximum position, you'll cook the rice within 10-15 minutes. If you keep your burner in the sim position, it will take 1 hour, half an hour. So your lower warmer fire is directly proportional to your kidney essence. For all suffering with back pain, my first advice, give rest to the body. Not physically, it's mentally or emotionally. Many ladies are getting pain because they are working restless. 365 days, daily 3 times without rest, they are cooking, they are taking care of kids, taking care of husband, mother-in-law, father-in-law, this, that. Run, 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 one day exhaust. So, as a healer, you should learn how to refill your kidney essence and which are all the food you can suggest to the patient and which are all the acupuncture points you can use, which are all the colors you can use. And even auricular therapy also, it's quite effectively it is used. So normally in our clinic, we will take around 2 to 3 months to solve back pain. But we are very perfect. If you keep your kidney essence in right way, even after 20 years also you won't get back pain. Because you are not relieving the pain. You are treating the body meridians and color points. It increases the essence in the body. So you can see, for example, if fire is diminished in the lumbar area, okay, so you can take left hand index finger. This is the spinal cord. This is head, chest, abdomen. Here, this is the reflex of hand, legs. Am I right? Your stomach, here is the heart, here is the nose. This is the body reflex. So if anybody feeling lower back pain, just apply the sky blue color here. Why you are applying sky blue there? The sky blue is increasing the heat. It is increasing the circulation in the lumbar area within short period of time, and you can see the great relief. You can see the great relief. One color, it will do magical changes in your pain suffering. Sometimes we are using 3-4 different colors based on the analysis and based on the symptoms and based on the diagnosis we do on particular patients. This will cure your back pain, but at the same time, parallelly, you should increase the essence in the body. And one more thing, yesterday I told in the class, most of us we are spending more. So you can use black color on the left and right hand of the thumb, like this. So this will reduces your stress, so that you are reducing the expenditure. You are avoiding the unwanted thinking, so that you are saving your kidney essence. Then there is one saying in our Indian science, any creation in the body or in the universe, it happens from the zero. Any creation. शून्य से सृष्टि होगा. शून्यದಿಂದಲೇ सृष्टि. Do you heard this word? Any creature in the world, it starts with zero. Now what do you want to create? You want to create the essence. You're eating food, but it is not converting into essence. So, to the kidney reflex, apply black color. And to the lumbar, apply black color. So, this sky blue is increasing the circulation and warming your spinal cord. And this black is creating the essence out of your food. When your lumbar becomes zero, when it becomes shunya, the healing creates. How you come to know? How much time it takes? It takes only 3 to 4 days. Within 3 to 4 days, your more than 50% of the problem will solve. Even though it is 10 years old or 20 years old. You apply both sky blue and black. And what to do? Take the food which is having more essence. Desi cow milk or ghee or buffalo ghee, cheese, which is a native breed, not hybrid one. Take finally, the kidney is the organ which creates the essence. To the kidney, the food is protein. Food is protein. What to do? Give the food which contains rich food protein and without genetically modification, like kidney beans, desi breed country chicken, desi breed egg, and seafood, which is naturally grown, like prawns, crab, fish.
Sir, think of vegetarians also, sir.
I told vegetarian first. I told beans. All the pulses which is in kidney shape. All the pulses. Only one condition from my side is my angle of looking into the food. You take any food, which I told now, the only thing is it should not be hybrid. It should not be genetically modified. That's it. I will tell you, even 20 years old back pain you can clear within 2 months. Even disc is compressed, slip, even it is spondylosis, whatever it is, don't put your brain there to heal. Instead of that, give energy to the body. Body grown from 3 kgs to the 60, 70 kg, 80 kgs. You don't know how to heal that L4, L5 disc. Body knows, but it doesn't have energy to do that. You reduce your expenditure, increase your earning, apply some colors. See the magic. Anybody applied the black and sky blue 10 minutes back? And are you feeling any changes? Because if you are suffering back pain, you can see the changes within 10-15 minutes. Very simple way, daily you can do this in home and you can see the magical changes within few days. Anybody wants to share your experience with these colors?
Sir, back pain has alignment issues also.
Yes, even alignment issues also we can clear.
So will this black clear the alignment issue and also light blue will clear the alignment issue, sir, in the spine?
Alignment will clear with the red color. Left hand middle finger, just apply the red color here, as I shown.
So can it be from nail point below? For cervical also might be there disalignment. Yeah.
So red will align the spinal cord. Okay. Yes, Pulse. What's your experience? You can unmute.
Good evening, sir. Thank you. It's really, there are no words to say, but yes, learning a lot from you. I cannot attend all the classes, but whichever I am, especially with the color, one which you had said in one of the classes of applying this black colors on the tips and zero on the thumb, below the thumb.
Yes.
I did it on one of my patients as she wasn't getting sleep and, the calming thing. She slept so well, sir. And she messaged me next day morning that I don't think so. I slept so well. So I said, please continue for 7 days. And then, we will go for the next thing. So that is one good experience. And yes, I've experienced this blue color thing again. I've applied it now 10 minutes back. I do have back pain. I feel little relaxed, but the same thing I had applied for one of my friends for her back pain. And like within 15-20 minutes, she said, I'm just good. I can get up and walk. So excellent. It's just it's magical. It's very nice. So
Thank you
thank
very much.
you.
So in this color therapy class, we are going into deeper analysis of each and every color. Without missing, just attend. I may take 5, 10, 15 classes, I don't know. But finally, by end of this color therapy, you will be expert. I can guarantee you that.
Sir, you don't need to guarantee. We can vouch by your teachings. It's
Uh,
excellent.
This color, you may attended color therapy or you may practice color therapy, but this course be some modified things and fine tuning protocols are there. Definitely you will enjoy.
Yes, sir. I am enjoying and I have enrolled for the class actually. So it's only that sometimes the timings are not matching food time. So, but I
But
make sure
say,
all your
8
classes, sir.
o'clock. So best time for dinner is less within 8 o'clock.
Yes, sir. But my husband comes late.
So don't
So,
worry, I will tell Joshi sir to keep the recordings even another 1 or 2 months.
yes,
So
sir.
a very depth subject. Okay, we are going in deep this time. So that's what you take time and revise the videos and learn.
Yes, sir. So can I ask one question?
Sure.
So actually from last 2 days, I from last night, in fact, because of the pain in my hand, my wrist got some, they are saying ligament. I can't turn my wrist totally.
Okay.
So they gave me some tablet. I don't know what has happened. There's so much of gastric issue that I kept burping and I got pain here near C17, CV17. Next to that point on the left side, it's very piercing pain and only burping. If I press the point, I keep burping like for 5 hours. The whole morning till after evening 5, I was only burping and there was a lot of pain. So I tried all the remedies of applying magnets and everything, but it's very bad.
Okay.
From
Finally, your wrist is
yes, sir.
controlled by large intestine.
Okay.
So this is the area, no?
No, sir. Small finger, the ulnar side.
Area. Okay, it's a small intestine.
Yes.
So this is a small intestine joint. Apply
Yes.
sky.
Sky blue. Okay,
Okay.
sir.
The large intestine, right hand small finger, apply green ear
Okay, sir. So dark green, correct, sir?
or green ear and sky blue ear and orange ear.
Right hand, basically, so I'm doing on the right hand little finger, I have to do the light blue color. And on the,
Don't confuse here. Left hand small finger, vata giant, sky blue.
yes, sir, done.
And right hand, are you able to twist?
No, sir. One side I can't.
Right
I
hand,
can't twist the,
purple color. It is increasing the flexibility.
okay.
And right hand ring finger, vata giant, orange color.
Right hand right finger. So I'm
So
just like,
orange, orange, purple, sky blue.
yes, sir.
You apply now. Now time is 8:50. I will talk to you at
So
9.
all hatha joint only, na, sir?
Yes. To apply now, definitely within 10 o'clock, you feel more than 50% you feel better.
Okay, sir.
You just talk to me at 9:50.
Yes, sir. Thank you so much, sir.
Yes, Karista Ora.
Namaste, sir.
Namaste.
Sir, color can we use at night?
Yeah, you can use at night. Maybe little effectiveness is little less, but you can use.
Okay, sir. I can use this during daytime and I can feel very good.
Super. See, it is
Sir,
increasing your essence.
Yes, sir. Actually, I don't know English more, so I am unable to. um, sorry, I'm unable to understand your language uh, properly.
Okay. My English is very simple, no?
I know your English is very simple, but I am from Gujarat state and I am purely Gujarati, so unable to understand.
Finishing this color therapy, you also understand English.
Yes, sir. Sure.
Thank you.
Thank you, sir.
Yes, Pratibha Ranka.
Hello, sir.
Hello. How are you?
I'm good, sir. Namaste.
Namaste.
I met you at your clinic in the April month. You
Yes,
remember?
remember.
Yes, sir.
I did Marma therapy for you.
Yes, sir.
Yes.
Sir, I want to give a very good that feedback of color therapy. One of my patients, sir, she is 75 years old and multiple issues she has. She can't sleep with medicine, with sleeping pills, but she can't sleep, sir. So I did that black dot, both the thumbs, and zero, and middle finger pink color.
Hmm.
She told me next day कि प्रतिभा मैं ऐसा सोई कि मतलब पूरे 10 years में ऐसा मैं सो नहीं पाई, वैसा मुझे नींद आया. So
Super.
thank you so much. Your color therapy is excellent, sir. Excellent.
Definitely in this color class, you do so many magics.
Yes.
Okay. So what are all diseases you want to cover? Just put it in the group, color therapy group. In each
Yes.
color, I try to cover the topic and that disease. Okay.
Yes.
Thank you.
I attended last time your color therapy class, sir.
Yeah. So every year, Basva Acu Academy is known for its research only. So even if you're attending color therapy, acupuncture, acupressure, auricular therapy, we are finding some new and fine-tunement in the protocols and analysis. Definitely you will enjoy this class also.
Sir, one request, please pick up my phone. I want to take your session, sir, online session. Please pick up my phone.
And that is only the difficult with me.
I called so many times, sir.
So morning 8 to 5 o'clock clinic, 6:30 I come back. After taking dinner, I'm here. By 10 o'clock, I have to go to bed and again the same routine starts.
What's the
I
right time?
try to reply you through WhatsApp, try to put the message.
Done, sir. Thank you so much. Thank you, sir.
Yes, Anushree Mamata.
Good, good evening, sir.
Evening.
Sir, I have given the black color here for sleeping to my sister-in-law. Yes, yes. She was taking pills to sleep for sleeping, and within 15 days, उनका pills एकदम छूट गया.
That's it.
And after 6 months, 5 to 6 months, बहुत अच्छे से नींद आती थी उनको. फिर अचानक एक दिन मेरे पास फोन आया कि आई एम नॉट, द कलर इज नॉट वर्किंग. Again, I have started sleeping pills. So I don't understand what happened.
Maybe.
So what should I suggest?
Very simple. Your zero is balanced now. You have to look after other color.
Okay.
The best suggestion we can give based on their tongue diagnosis. Check out their tongue. Okay. So whether pale, red, wet, or white coat, like that. I will tell that also in this class, how to diagnose the tongue also. So maybe their vata is more because of excess momentum and thinking. They are not getting sleep. Just reduce the vata. Left hand small finger below the nail. Just apply sky blue color here.
Okay.
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 So, There is not one cause if you are not getting sleep or if you are getting back pain or if you are having indigestion. There's a multiple reasons will be there. So for each disease, it's better to learn 4 to 5 different angle to see that, so that you can create new protocols by yourself.
And
Now
I have given left hand, small finger,
below the
sky
nail.
blue.
Yes, yang
Below the
line.
nail, yes, sky blue. I have given her green color also
Okay.
for the वो हड्डी के लिए. She was having pain in क्या बोलते bones.
Okay.
I have given green color.
Here.
Yes.
Okay.
It was good.
Yeah.
Good result.
Only bone pain comes due to the bone density is going down. The moment you apply color, that will feed the better water energy to the bone.
Only in one finger.
One finger, one color will give you one excellent results.
Acha. Sir, nowadays I am having indigestion because I have talked to you. I have मेरे को cancer diagnosed हुआ, thyroid and lung cancer, and I have called you. You have given me number 6.
Yes.
In orange.
Yes.
I 6 month 7-8 months हो गया मैं वो number 6 ही यूज कर रही हूँ. Should I change this now or what?
How are you?
I am fine, but back pain and indigestion बहुत ज्यादा तकलीफ होती है. Daily lose motion because of the medicine. Doctor is saying because of the medicine. It is because of the medicine.
Okay, now you can use yellow color. Just write number 5 yellow color on the palm.
Okay.
That's it.
I am taking the medicine Imodium.
Whatever it is, leave out the medicine. We are working on the energy path lines. So just write number 5 yellow. So you can improve a lot of things.
Okay, sir. Okay, sir.
Thank you.
Sir, can I come to Bangalore to show you?
Yeah, you can come next month, not this month.
Okay.
Thank you.
Okay.
So nowadays, many people are suffering with the dengue. Okay. Due to that, the platelet count is going down. So it's a one color you can use. Right hand, ring finger, kapha joint, you can apply red color here. By applying red color, you can stop further decreasing of the platelet. And you can also give right hand, index finger, middle joint. You can apply orange color. Okay. Orange here and red here. So do this.
So this is left hand, right?
Yeah. Right hand's ring finger, kapha joint, red.
Yeah.
And here orange.
Index finger, left hand, orange.
Okay. So this will reduces the spleen sensitivity. Spleen is responsible for killing the blood cells after the certain time. But it is hyperactive. It is doing that job much faster. You have to reduce the time by putting red color ring. So orange here to just increase the delay of the blood cells timeline. Okay, just do these two things. It will improve your platelet and it will stop further going down. Okay, fine. Yes, Sanadam.
Namaskaram. I have a small question. The pens, what kind of pens we should select? Whether you should go for the Camlin marker pen or sketch pen or ink? Which one I should use?
Go for marker pen.
Oh, Camlin marker pen, sir.
So what it is called? Little artist. Little artist.
Oh, little artist. Okay.
It's a brush
The
pen.
marker pens you should use.
You can use brush pen.
Yes.
Little artist quite fine. It's a 150 rupees investment, and
Okay.
there it is natural and what are all the some quotations will be there. It
Not
is a
artists.
and all. So you can try that.
Okay. Thank you. Thank you. Thank you.
Fine. I hope you got an relief with some issues. Yes, Rushali, any question or any feedback you want to share?
No, I have a small question. Today you took a, session on lumbar pain and all. So if someone's lumbar L1 is attached to the other vertebrae, say T12 or L2, तो जो चिपक गया है लंबर का L1, वो भी आपने जो ये बताया है उससे क्योर होगा?
You mean slipping of disc.
No, not slipping of disc, not also gap. वो मतलब चिपक गया है,
Attach it to the other.
अटैच हो गया है
Compress.
दूसरे सेकंड लंबर.
Okay.
sir.
If you have a compression, you can use purple color.
Where, sir?
Right hand small finger on the lumbar. You just apply purple color here.
Right small finger, purple color.
So that will create the gap.
Okay.
Okay. Thank you.
Okay. Thank you, sir. Thank you.
Yes, Anish Srivastav.
Hello, sir. Very nice. I just needed this. So I also have numbness in my right hand feet.
Right side foot.
Yes.
Yeah, the same. These three color will work. Sky blue,
Okay.
red, purple. When you apply
Okay.
that, your lumbar become flexible, and then the circulation starts.
Okay. Okay. Sure.
Okay.
Thank you. So the knee pain is also coming inside while walking. So would this also help there also? Same thing?
These colors, it may gives 50% relief to the knee pain. So in that next class, I will tell in detail so how to
Oh,
work with the knee pain, how to increase the gel and cartilage, and how to create the flexibility on the knees. We'll discuss in the coming class.
sure.
Okay.
Thank you. Thank you very much.
Just for giving introduction, so how colors works on the, especially on the lumbar and sciatica related issues. Yes, Aisha Patimo.
So my daughter is 19 years old. She's getting pain in this area, GB22, this area.
It's the GB.
She's getting prickling pain, and then she get very weight. She feels if she get down, she feel weight.
Heaviness.
Heaviness.
Only three colors will work. Right hand ring finger on the cervical joint, apply orange.
Yes.
Apply orange here.
Ring finger.
Yeah. Okay, orange here, purple here.
Okay, sir.
And sky blue here. Left hand small finger, sky blue.
Okay, sir.
Okay.
Sir, where are you, sir? Your clinic is
in Bangalore. Just Google Basava Natural Healing Center.
okay, sir.
Everything is open. Okay.
Okay, Basava?
Basava Natural Healing Center.
Okay, thank you, sir.
Thank you. Yes, Dr. Rajeshri Remat.
Namaste, sir.
Namaste.
Sir, actually, my mother-in-law is having so much pain in the right knee, and I applied magnets and also tried the nail therapy also on her. But she's not getting relief, sir. She's her pain is worsen at evening. At morning, as I applied magnets, she is feeling well, and till evening she starts again paining so much. Sir, that's why I'm asking.
Where exactly?
Sir, at right knee, sir, in the medial aspect, sir.
Right knee. Just apply. You can one color sky blue.
Yes.
And left hand small finger and knee joint, you put one sky blue dot here. Okay. And one more color, instead of color, you apply sky blue dot here. And you know biol meridian points?
Yes, sir.
You just put on liver one, you just put one pepper seed.
Okay, sir.
Within 3 days, the 90% of that knee pain will vanish.
So please, can you repeat it, sir? As because of network issue, I didn't hear first point you told, sir.
Left hand small finger on the right knee reflex, apply sky blue color.
Okay, sir.
And only once you have to apply on liver one pepper seed, only 10 minutes.
Okay, sir.
If you do it today, within 3 to 4 days, you can see the 80 to 90% relief.
Okay, sir. Thank you, sir. Thank you.
Thank you. There's a different protocol creation happens when it is a knee pain in the left, right, or backside, front, or whether it is covering liver meridian or GB meridian. And is there any sound coming out of it? Along with knee pain, any other symptoms are there? Okay. So if you want to give the better results, you should always learn how to correlate one symptom to other symptoms. If anybody are telling back pain or knee pain, I have a set of questions. I won't treat anybody. If you have right knee pain, I'll ask next question. Do you have a headache? If you tell a lower back pain, do you feel your urination is slow? So like that, each time, every symptoms is producing some other symptom. You have to ask that. That is where the secret of understanding is there. So in TCM, it is called interrogation. So TCM clearly says the diagnosis happens in 4 different ways. One is watching, interrogation, pulse diagnosis, and listening. If you are able to cover these 4 things in your diagnosis, your accuracy of diagnosis improves. Then, if you touch one point or one color, the healing will be faster. If you treat a same knee pain with a different point, even for 1 or 2 months, what is the use of it? You spend maximum time in the diagnosis. In 2018, we released one device called Nadiswera. I think many of our students are using that device and getting treating patients successfully in 2018. So that is a small sensor device which is reading the pulse through a radial sensor. Based on that, it is diagnosing. I'm doing a little more research on the diagnosis because you might have seen me in the clinic. Every 3 minutes, I see one patient. In that 3 minutes, first I watch their face and tongue. Next 1 minute, I check their pulse. Next another 1 minute, I will ask few questions based on your problems. Then only I finalize the diagnosis. Now what I am doing, I am upgrading Nadiswara. This time, device is much more accuracy and the cost of the device is only 30% of Nadiswara. I think many of you are paying 35,000 for Nadiswara. No? I will promise you, I will give you Oohy less than 10,000. Everybody can use. This is a wonderful device, first time in the world. No one is doing. Anybody seen in one device, pulse diagnosis, tongue diagnosis, questionnaires, all these things? No. Just wait for 2 months. Oohy is on the way. So yesterday night, my research team is shared some of the results. We are doing artificial intelligence and machine learning. A 20 years old team. I have a team, different teams. In that 5 students, their age is only 20 years. They told, have you do machine learning? Yes, sir, we will do. I just took as a apprentice. They are going to college and they are also working for me. See, they are such a humble and curious to learn. Sir, how this tongue diagnosis works? I taught them one day how it is working and all. And they told, sir, give me 2,000 images in each category. We will give you accuracy of the diagnosis. Then I told, every week I will get 200 patients in clinic. I'll give you 500 images. Because the accuracy of the machine learning will increase if you give more and more data. For example, if I'm giving Oohy to you in this November or October, if accuracy is 90%, if 5,000, 6,000 people are using every day, we'll get more data to the server. Then by next month, it will become 93%. Next another 6 months, it become 95%. So the algorithm is learning with your data. By giving just 500 images, they're given almost 80-85% accuracy. Before launching Oohy, I promised those students I will give you 2,000 devices in each category. So I'll just show you some of the images, how best it is working. It's in WhatsApp. Is it visible?
Yes, sir.
Yeah, see, this is done by students. Such a wonderful work they are doing. Look at this. Is it visible?
Yes, sir. Yes, your screen is visible, sir.
It is. The tongue is, I just given the tongue, they are giving the output. So this tongue is a damn cold. See, damn cold is 0.94% and liver cheese stagnation is 0.06%. Like that they are showing. This is how they are working on this. So it's a spleen dampness and liver cheese stagnation. See, look at this image. Very clearly saying this tongue has a damp cold. Okay. So spleen dampness is 58% and liver cheese stagnation. See the side of the tongue is a gray and black. So that is the liver cheese stagnation, 0.42%. So like that, they are showing the wonderful data. Many things is coming on way. We are using the advanced technologies here. So look at this. This root of the tongue is white coat and spleen area is a little dry. It's a spleen heat. See, look at this. This is the side of the tongue is having black mark. It's a liver cheese stagnation. And spleen area has a little crack. This is the spleen heat. So we are working on this. definitely. In July month, we are giving color therapy. In August, September, we will give you TM. October, November, we are planning for Oohy. Some are telling it looks like a Chinese name. No, it's a pure Dravidian language. Oohy means guessing. In Tamil, it's called Oohy Kirad. In Telugu, it's called Oohinchedi. In Kannada, it's called Oohi Suvudu. So all meaning is same. Oohi means guessing. To our Oohi, just 4 or 5 times give your data. 6th time it will tell what you are, what type of problems you get, and how are you in another 6 months. So this is the advantage of machine learning and artificial intelligence. When I did first device, Nadiswara, in 2017-18, so that time this artificial intelligence and machine learning is not much into the picture. So with that, we did only pulse diagnosis. Now we have more data, more patients, more research, and advanced algorithms. I hope each one, see, finally, we're all healers working in this field. That too, people are not accepting it. If you create one software, one technology, how people are believing the blood report. Like that, I will show you how is your pulse, tongue, and based on your question and answers, I will tell you your diagnosis. You don't believe until unless I tell you about you. I will give you a report of 3-4 pages. Read it. If you feel it is matching you 99%, exactly same way I am suffering, then only you accept. Because putting one color, what happens? Putting one seed, what happens? People who are not into this, they are feeling that. But we know how this color works, how single point will work. We are into this. Okay. So this is time to show the world. Even alternate therapy has a lot more research and accuracy. And we are into technology. How why modern science is so popular and how it made the people to accept it? Because of the technology. Why can't we bring the same technology to the acupuncture, acupressure, color therapy, and Ayurveda? Definitely we can do that. So this OOE supports the thousand and lakhs of healers across the world. We are not treating simply unscientifically. There is a data. There is a research. We do this. So one more advantage of this is this OOE gives you color therapy, auricular therapy, acupuncture, mudra, yoga, and many more healing science. So Nadiswara is having only acupressure, no? Acupuncture. So this time we are planning to cover the broader way because many yoga trainers want some scientific support. What happens after doing 1 month of yoga? You take one report before and after. Tell them how is your tongue and pulse before and how it is now. Okay. If you made real changes in the lifestyle, food, and some activities, definitely you should get benefited out of it and you should heal. That healing has to show on your pulse and tongue. It has to show, no? So that you are trying to prove. Okay. Many people, they're feeling good. Still they're telling, oh, not much changes. Oh, okay, they tell. This is the healer's experience. But with the doctors, they're not telling anything. They're taking antibiotics and taking and sleeping. Even there is a lot of side effects. So we work together. Okay. The final thing is, if you search any devices, no one will match Oohy. That's the secondary. But no devices is less than 1 lakh. Only few devices are there. That too more than 1.5 lakhs, 2 lakhs. Indian market is very toughest in the world. It is not my words. The Uber CEO is telling few months back. So we should give best and that affordable price. So that's what we are planning so even common man should take this. See, with this Oohy, all 10 different therapies will come. It's auricular and acupressure, acupuncture, many more things. Okay, just wait. Within short period of time, we will update. And overall, using Nadiswara, they can use Nadiswara, and with the same sensor, they can also use Oohy. Okay, the only thing is Oohy coming with the Bluetooth technology. So Nadiswara is having a USB cable. That cable won't be there in the Oohy, because the disadvantage with cable is after using few years, so that will break. That will get some problems. But if you are using with the Bluetooth, even if you use 5-10 years also, 99% of the time you won't get that physical damage issues. Okay, let's see how we can upgrade to Nadiswara also. We are thinking on it. So maybe we will announce by August end, next month end. Okay. Any questions related to today's topic, or any betterment you felt after applying 3-4 colors? Anybody? Faisal?
Yeah, good evening, sir.
Good evening.
Your ex-student, sir.
Yeah, I know.
Sir, you said you want to upgrading the Nadiswara. So the one that we have now, is it still applicable, or will it going to be obsolete?
Don't worry. We have planned to make Bluetooth. Okay. So if it is applicable, I will check the technology flexibility to combine. If not, I will give you a new sensor. That's it.
So the old sensor will not be.
That still you can use with Nadiswara. Nadiswara will be there, and that is also upgrading.
So the new sensor we have to purchase, sir?
Yeah, so obviously for Nadiswara users, we will just take only hardware cost and we will give.
Okay, thank you very much, sir.
Thank you.
And there might be a different app for Oohy, sir?
Yeah, there will be a different app. And that app, not only it is a diagnosis tool, we are putting all our research there. For example, today I told how this back pain manifests in the body. So this is the research we did on the 100 of patients over the year of few decades. So we will put everything in text or image format, and we'll try to enhance the healer's knowledge. See, finally, if you want to sustain in the market, all healers should have the research data. If anybody, doctor comes and tells you how you cure knee pain or back pain, you should have valid data. I'm treating now, how he is in the first week and next month or next month, and what I did. After my treatment, what food changes I made. So we have a separate research team for Oohy. They are what are all the research we are doing in the Basava Natural Healing Center, Basava Acu Academy. That research will put it in the form of videos and in the form of PDF, text, and even PPTs, so that all healers can refer that. Okay, we are making the one-point access for research as well as for diagnosis too.
So only one request.
Yes.
It should be compatible to iPhone also, so because normally everyone comes with Android and people with iPhone just get stuck because we are not able to access the apps, or they are not available.
That we took even 6 months back only. We made a separate team. So now the moment, the day one we launch, we are launching with iPhone and for Android, even for laptops.
Yes, sir. That will be great, sir, because we find it very difficult. Most of the time, if someone is launching an app, we iPhone users don't get the benefit.
No, we information I got because since especially since 2-3 years after Corona, more and more people are buying the iPhone, especially after iPhone 12, 13, and 14. More people are getting iPhone. We want to take care of them also. Definitely, we are covering that.
So, and for the application that you told me for the burping and the pain, what I have, burping is less, but my pain near that CV17 left side of the CV17 is still there. Like it
Don't
is
worry,
some.
you are applying the sky blue, no?
Yes, sir. I've applied sky blue on the left little finger, orange on the right little finger, and the purple you said on the ring finger, right side.
Ulta. This is sky blue, this is orange, this is purple.
Right side is purple, sir. Right small finger.
Finger is orange, small finger is purple.
Okay, I have done it ulta.
You got relief, no? 50%. Now you interchange the color, 100% relief you'll get.
Okay, sir. Thank you.
Thank you. So like that, after applying colors to anybody, please mention the name because so many people will get confused between red and orange, between sky blue and green. So many times it happens. Okay. So that's what whenever whomever you give colors, please mention the color name also so that you can avoid the confusion. Okay. Thank you. Yes, Kavita, any question?
Yes, sir. Sir, I even applied this black color here on the tip of the thumb, as well as here and all the fingers. So the first day I got a nice sleep, but the second day I was still like, I didn't get the sleep. First day it was nice. I just slept, I think I slept around 11. I woke up at 4:30. And usually I have a tendency of getting up in between my sleeps. Like, I have like very short span of sleep.
Okay. I'll tell you, your voice is breaking. So for you, I'll give you, by seeing you, I can give one color. Just write, you take just dark green and apply on the right hand index finger below nail. You get a very good, nice sleep. Okay, thank you. Yashdeep, any question?
Hello.
Hello.
Namaste, Namaste, sir.
Namaskara.
Yes, sir. So you told about black color in the last class, sir.
Yes.
Before also I took class, so I applied whenever I apply black color on my head, on my thumb, or once I tried black with zero. So whenever I apply that, I feel anxious and fear kind of means. I feel anxiety in my chest and all this means. I have problem of with, breathing and all. So whenever I apply that, I feel frightened kind of means. So I don't know why it is happening.
See, blacks makes you zero, no? So if you're already having some coldness in the heart or the kidney meridian, you may
Yes, sir.
feel, okay. Instead of black, for you, the best color is sky blue.
Sky blue.
Yeah.
Okay.
Just
On
sky
left
blue.
index.
Yeah, left index finger. So that brings more and more confidence and energy in you.
So I feel all stuck here, chest here, full stuck here, and all this means. So
Yes. It's a fire. It raises the fire and increases the circulation in the upper body, and you feel free. Okay.
Okay.
Thank
So
you.
okay. Thank you, sir. Thank you.
And update me. Minu?
Hello, sir.
Hi.
When I apply, sir, black color dot on thumb and all the tips, I feel very uneasy, sir.
So that's what even the previous student told. So black color that takes you to the zero. When you have a yang deficiency, you feel some that difficulty variation. Whoever felt discomfort with black, all of them they can use sky blue.
Okay, sir. Or my second question is, I feel Not energetic, sir. Every time I feel dull, dull, dull.
The answer is same, sky blue only.
Sky, where
Left,
apply?
left hand index finger below the nail.
Only one dot.
Only one dot, that will clear your dullness.
Okay, sir. Or sir, last class I asked you my son tuberculosis about. You say black color lungs area.
Yes.
Regular
Can
this
any infection, tuberculosis is also one of the bacterial infection. So black color will clear the infection.
every time, sir.
Yes.
And after you say violet color.
Violet
One
color,
week.
violet color on the lung reflex, which makes the broader, that it increasing the space in the lungs and for better breathing.
Where we apply violet color, sir?
Right hand small finger kapha joint here.
Okay, thank you. Say same time, sir. Apply
Yes.
the
Yeah, apply both. Overall feeling breathing difficulty, this purple will do magic. And how it is doing magic, we'll learn in the tomorrow's class.
Okay, thank you so much, sir.
Yes, Swati, any question?
Sir, I just wanted to know one color for glaucoma, 6-year-old. Glaucoma.
Just 6 years old.
Yeah.
You can apply sky blue on both index finger middle joint.
Okay, sir.
Okay.
Fair. 4 hours.
Daily 4 to 5 hours. You apply just 3 to 4 weeks. You can see a lot of improvement. And weekly
Okay,
one
sir.
time.
Thank you.
The reflex of the liver 20 to 30 times.
Okay.
Okay. Thank
Fair.
you.
Thank you, sir.
Yes, Ashish.
सर सर मुझे है
Yeah, audible.
सर वो माइस्थेनिया राइट साइड थोड़ा लूज हो रहा है, वीक हो रहा है, राइट साइड आई ड्रूपिंग हो रहा है.
Right high drooping. Okay.
हाँ, राइट साइड.
Okay. You do one thing. Right hand index finger middle joint. First you apply yellow color ring. Upon that you apply sky blue color. Yellow and sky blue for eye dropping. Okay. Thank you.
Okay, sir.
I hope you gotten just the glimpses of color therapy. So actually I just told one color, how we can use the black, okay, for different purpose to increase your kidney essence and to reduce your stress, to nullify your excess thoughts in the mind. So tomorrow we'll see how other Vibgyer colors are working. Okay.
Sir, tomorrow we will have the session, sir.
Yeah, tomorrow we have session.
Okay. Dear friends, please note that tomorrow also we will have the session from 8 to 10.
Okay. Sure.
Okay.
See you tomorrow morning. Thank you.
Thank you very much, sir. And thank you all participants. Thank you and good night all.
Good night, everyone. See you tomorrow at 8 p.m. Please be on time. Thank you.
Thank you, sir. Thank you, ma'am.